availability of hand washing stations with soap and water in healthcare facilities, entrances and exits, near bathrooms and toilets, and all points of care. If there is no running water, all means must be put in place to secure continuous availability of water for healthcare facility uses, marketplaces, places of worship, learning institutions, and bus stops. This may require transporting water or increasing on-site water storage capacity. Our healthcare workers should religiously follow the World Health Organization's infection prevention and control slogan of "My 5 moments for hand hygiene" and practice it. These 5 moments are: before touching a patient, before clean or aseptic procedures, after body fluid exposure or risk, after touching a patient, and after touching patient surroundings. In areas where trucking of water is opted for, each truckload should be checked for free residual chlorine greater than 0.5 milligrams per liter to ensure water safety. Allow the water to settle in the tank before releasing for use, and ensure regular cleaning of storage tanks. High standards of hygiene is the number one measure of keeping the coronavirus disease at bay, even as we employ other containment measures of wearing face masks, social distancing, as well as avoiding public gatherings. We as a Ministry of Health are so far quite impressed with the majority of Kenyans who have taken up the containment measures seriously, particularly that of hand washing. Of particular mention is the fact that when one walks around our various buildings, be they eateries or even commercial places, you cannot fail to notice the hand washing facilities placed outside. This is indeed very commendable, and we urge those who have not yet embraced this new culture to do so immediately, if we have to curtail the spread of the virus and many other infectious diseases. According to our data, 29,538 of the confirmed cases, COVID-19 confirmed cases, are local transmissions. This is 98% of all confirmed cases, which means that the virus is fully domiciled within our communities, in the villages, estates, our counties, and the entire county, since now all the 47 counties are affected. Nairobi and Mombasa counties continue to have the highest attack rates of COVID-19 at 406, 407, and 184 per every 100,000 of the population, respectively, when compared to the national average of 63 persons infected per every 100,000 of the population. As of yesterday, Kiambu County had overtaken Mombasa to take over position 2 in the number of those with confirmed cases. Nairobi County continues to lead with 17,889 confirmed cases, followed by Kiambu with 2,228, and Mombasa third with 2,224. Kajiado comes a fourth with 1,627. At the other end of the spectrum, Elgeyo Marakwet and West Pokot counties are the least affected with 6 cases each, respectively. It is therefore important that people in these counties and across the country should be extra careful with their adherence to the containment measures. Turning now to our COVID-19 statistics. Over the last 24 hours, 245 people have tested positive for COVID-19 following testing of 3,150 samples. This now brings our total number of COVID-19 cases to 30,365. And our number of total tests that we have conducted to 394,566. From the 237 Kenyans that are positive today, 8 are foreigners. 145 are males and 100 are females. The youngest is an 8-month-old infant and the oldest is 79 years old. Distribution of cases by counties is as follows: Nairobi 149, Kiambu 23, Kajiado 14, Mombasa 10, Garissa 9, Machakos 9, Nyeri 7, Narok 7, Busia 4, Kilifi 3, Laikipia 2, Muranga 2, Kitui 2, Kisumu 1, Uasin Gishu 1, Kwale 1, and Tharaka Nithi 1. In Nairobi, the 149 cases are in Langata 25, Kasarani 14, Embakasi East 12, Embakasi South 11, Makadara 11, Dagoretti North 10, Embakasi West 10, Roysambu 9, Ruaraka 8, Starehe 8, Embakasi North 6, Kibra 6, Westland 6, Dagoretti South 4, Embakasi Central 3, Kamkunji 3, and Madare 3. In Kiambu, the 23 cases are from Limuru 6, Ruiru 5, Kikuyu 4, Thika 3, Kabete 2, Juja, Kiamba, and Kiambu Town 1 case each. The rest of the information and breakdown of cases by sub-county, you will find them in the document once you have received this brief. On a positive note, I'm happy to inform you that 504 patients have recovered from the disease. From this number, 461 are from the home-based care program, while 43 have been discharged from the various institutions, health institutions that they were receiving care in. This brings the total number of recoveries to 17,160. Again, I want to thank our healthcare workers for the good work they're doing that has enabled us to achieve these results. At the same time, sadly, we have lost 8 patients to the disease, bringing our total cases of fatalities to 482. From this number, 5 out of the 8 that we lost had underlying issues. We want to convey our sincere condolences to the families and friends of those who have lost their loved ones. Thank you.
My name is Mwangi Maina from TV47. There is a tweet by KMPDU Sec Jen Chibanzi Mwachonda, and if you allow me, I'll quote. He says, "In a country like Kenya where corruption reigns amidst COVID-19, there is no reason why healthcare workers should continue risking their lives on the front line. Henceforth, we should all stay home for our own safety and protection." He's reacting to allegations of corruption at KEMSA and the Ministry of Health. What is reaction to these? Thank you.
Elfas Lagat from Citizen TV, and yesterday you reported 271, today 245. Is it finally a flattening curve, or the curve is on a downward trend? And another question is, like private facilities, it takes close to 2 days or 3 days perhaps to receive your results once you get tested. And perhaps if you can elaborate more, where do you get these numbers that you report every 24 hours? Because again, looking at the duration that you wait to get your results vis-a-vis the numbers that you give daily, there's a bit of disconnect there. If you can clarify. Thank you.
My name is Beldin Waliula from KTN. A clarification on breakdown of PPEs. The donated one, the bought ones, how they distributed to the healthcare workers, and how comes we still have a shortage if the ministry has assured us that the local manufacturing is doing well. And also my second question is on our testing strategy. Where are we in terms of testing for COVID-19? Who are being tested, so as to give us the numbers that you announce every day, and also the turnaround time of the tests. Like in Nakuru County, turnaround time is 10 days. So how do we get our testing done?
My name is Purity Musel from KBC. All the 47 counties have reported cases of COVID-19. Do we still have counties that are yet to meet the 300 isolation bed capacity requirement, and which counties are these?
Okay, thank you. Let's start with the question by Mwangi from TV 47. You know, you have mentioned the quote that was given by a member of the Kenya Medical Practitioners Union. I would say that as professionals and as healthcare workers, we have an obligation to serve those that we have spent our careers in developing the skills to be able to serve them. In the practice of medicine, there is something called the Hippocrates Oath that doctors take to serve. And when you take that oath, you serve under whatever circumstances. Yes, there may be issues, there may be things that might surround that environment you work in.
I mean, we. Mr. Speaker, a narrative has been planted in this House. The other day, Bishop Muller of AIC told me, when the churches were closed, that when you close churches, the devil rules. After COVID, I think we allowed the devil to walk into this chamber. That devil is ruling this chamber. And